Yeah, thank you, ladies and gentlemen. My name is Victor Obasuyi, and the channel is My Take on It with Dr. Victor Obasuyi. Today, I'm going to be addressing another question that I get asked frequently at the clinic, and that is especially from new parents. I have a new baby. When should I have the eyes checked, and how often should I be checking? Surprisingly, when a child is born, the at the hospital where that child is born, most times they check at that point for things like congenital cataract. Congenital cataract means cataract that is there from birth. Then there could also be things like what we call coloboma. These are all neonatal eye diseases. These are checked right at when the child is born, a day or two after, before the parent takes the child home from the hospital. So for those kids that are born at home, especially in third world countries, I would recommend having this done. So first, when the child is born, then second, from 6 months to 1 year. Again, the baby has to be checked. At this point, it may people may wonder, what are you checking for? The child cannot respond. True, but what we are checking for at that point is something like a lazy eye or crossed eye, which is called strabismus. So amblyopia or strabismus, we check at that point. On most times, how do you do this? From light reflexes, you can tell when you shine light into the eye. Based on the reflection back from that light, you can tell if there's a problem or not. Then, when the child is about 5 years old, between 5 and 6 years old, so the first time when the child is born, then 3 to 5 years, then 5 years, just when they're about to start school. At this point, they can easily identify the uh, um, alphabets, or on the VA chart, if they can't identify alphabets yet, we have pictures that we use. If they can't identify pictures, we have we do what's called matching. You project an image on the wall. The child has a paper version of it. Then they point to whatever is on the wall. So that is used to check their vision. So this is done before school starts. This way you can tell if the child is prepared for school, because a child that cannot see what is on the board will definitely struggle with schoolwork. Then we also, at that point, we're now checking for, again, if there's lazy eye, if there's strabismus. Strabismus means what people call cross eye. This case, what happens is you can, at that early stage, cover the good eye and force the lazy eye to uh, to work. So you can it's easier when you have a lazy eye to deal with the problem at that initial stage, compared to waiting for the child to be maybe about 9, 10 years before you bring the child in for the first eye examination. So it's important. These are the things that we check for at that stage. Then some parents ask, how do I even know if my child has a problem or not? What you should be looking for are things like if the child is always squinting, you find the child is always squinting, that is a red flag. Then if you find some kids, they keep rubbing their eyes. When a child is always rubbing their eyes, a lot of times what is happening, or you find them blinking often, that is a red flag for dry eyes. Why they are blinking often is because when the eye is dry, every time they blink, they pump new tears into the eye, but it tends to evaporate faster. So they compensate by blinking often or rubbing their eyes. That's they're squeezing the eyelid to produce tears. So those are things that you should that should alert you to see the eye doctor. Then sometimes you see when the child is watching, they tilt their head like this. Maybe they're watching TV, you see them always tilting their head, and most times in one direction. It's not that they tilt their head this way today, tomorrow they tilt their head in the other direction. If you find that consistently the child is always tilting their head to see, then that's another red flag that the child should see an eye doctor, because it means the eyes are not properly, they're not aligned properly. Then a child that complains of headaches from time to time, especially when they have to do reading or anything near work, it tells you also that there's a problem somewhere. Most times, if you solve the vision problem, the headaches will subside. Headache can bring that child down, So most time the kid doesn't want to go to school because they are now afraid that, oh, I'm going to have headaches again. So that is another part that one has to always look for. Then when you tell the child to read, they can't really go through a straight line. They go like this, then they skip to the next line, to the other line. Then of course you know that that's another is another indication that that child needs to see an eye doctor. Then there are kids that you see them, they always close one eye like this. They say, "Oh, I see better when I close one eye." And what do you think they're doing? That child is having that child has a lazy eye. So most times they close because when you have two eyes and one eye is lazy, the brain will take the image from the good one and ignore the lazy eye. What happens? That lazy eye over time will drift, so it doesn't now send message to the brain. So that's why most times lazy eye and cross eye tend to go hand in hand. So most kids will figure this out. So they know, okay, if I anytime I keep my anytime I keep both eyes open, I tend to see double images. So they will close one eye, so that way they are seeing just one. So if a child is telling you, when I'm looking at things I see double, is a red flag. Go and have that child checked. So these are little pointers. Then, if you are families that are predominantly short-sighted, of course, genetics, that child will most likely pick up the same thing. So it's always good to have, if you have a family history of short nearsightedness, have your kids checked. Then if you have things like something like keratoconus, which means the shape of the eye of the cornea, instead of being spherical like a ball, is shaped like an egg. And this can also be induced when the child keeps rubbing the eyes all the time. That can cause keratoconus on its own, even if there's no family history of it. But if you have a family history of keratoconus, then the kids should be checked early and most times yearly. Then when the kids are of school age, every child should be checked yearly until they become adults. So there's no need waiting for, oh, the child did not complain, because sometimes the kids might have very short sight, and because they've never been tested before, they believe that every other person sees the images blurry just the way they are, so they won't complain to you. But once you put that child on the examining seat and tell the child to read, you find that they are struggling. Then once they pick their first glasses, you'll see that expression of, wow, I can see everything clearly. Because before now, the child thought everybody was seeing the same blurry image like they're doing. So there was no need to complain. So there is no need waiting for your child to complain. If you have family history of eye disease like glaucoma, early cataracts, and things like that, have your kids checked yearly. But if you don't, at least once in 2 years. But it's all almost the baseline is always once every year. But if you can't do every year, not more than once in 2 years. So I just thought I'd share this with you guys. So there's no need asking when or how frequent. The answers are here for you. Thank you.